What we know today now is that there are 8 cases. Not all of them are confirmed, but 8 suspect cases with 3 fatalities. The newest case is someone who had disembarked along with about 2 dozen people at an earlier stage in the cruise, at a stage after cases had already occurred, but no one knew what was going on. And this person was responding to an email that he got. If he had symptoms, was in Switzerland, confirmed to be another case patient. We've also learned that this is the Andes strain. This is the type of hantavirus that is, in certain circumstances, communicable between individuals. This is what people suspected because it originates in Argentina. Other things that have happened, what we know is that there is now movement of this ship towards the Canary Islands, which are governed by Spain. There's been some controversy back and forth between the regional president and the Spanish central government. It seems like this is going to happen. And some of those individuals might be put, the Spanish ones, in military hospitals, and other people repatriated if they're not sick. There's going to be a thorough epidemiological and clinical investigation in the Canary Islands when this occurs, probably in 3 days or so, so like around Saturday. 3 sick people were sent to the Netherlands. This is a Dutch flagged ship, including the ship's doctor. This was done from the Cape Verde Islands. And the Cape Verde Islands has maintained that they can't take these patients because they don't have healthcare capacity. But that doesn't mean they can't use hotels for the patients that are not sick, because this is not a highly communicable disease. Even if there's been limited human-to-human transmission, they don't need to necessarily move those people. They can get them to hotels in the Cape Verde Islands and have them monitored there. There is rumors of a case in France related to someone who flew on a plane with one of the individuals that was a case patient. This is hard to track down. I don't know if it's actually a case or just a case contact that's being monitored. We'll have to wait and see what happens.